Welcome to another episode of Health Watch, reaching you on the Station for Excellence NTA Lagos Channel 10. There has been an outbreak of cholera since the month of July. In fact, NCDC says, Nigeria Center for Disease Control says, that cholera is presently in 28 states in Nigeria. That's a big concern, and it's an alarming issue for us all in Nigeria, especially at the time we're battling with the pandemic. Plus, we have about 3,057 cases of cholera till date. Okay, on this episode of the program, we brought to you an authority in the field who will be telling us what we should know about cholera in terms of causes, the risk factors, and of course, preventive measures. Plus, we have a feature on self-medication. My name is Nkem Kibe. You know I love to do this with you every week. We'll go on a short break. We'll be right back. Stay with us.
As Nigeria joins in the global fight against COVID-19, we must all take responsibility for the health of our loved ones. COVID-19 knows no borders, age, gender, tribe, or state of origin, and most importantly, it has no cure for now. The only way to defeat this unseen enemy is to prevent its spread by obeying the NCDC guidelines on COVID-19. Wear face masks in public places and maintain physical distance and wash hands regularly with soap for at least 20 seconds. Do not sneeze or cough into the open air. Instead, use tissue paper or sneeze or cough into your elbow. Generally avoid crowded places. If you develop any symptom, don't wait till it becomes severe. Get tested immediately. Check into an isolation center if you're positive, and remain there until you test negative. COVID-19 is real. Let's fight it together.
This message is endorsed by the Broadcasters Guild of Nigeria, BGN.
If you're just joining us, the program is still Health Watch, and the topic for today is on cholera. My guest today is someone who has traveled around the world. He's been to several African countries and, of course, European countries too, and he's a UN ambassador. But most importantly, he's a doctor, Dr. Precious Uwagbai. You're welcome to Health Watch.
Thank you, Kim, for having me.
Thank you for honoring our invitation. I know you've been very busy, but I brought you on the show today.
I feel excited to be with you, and thank you to our viewers. Thanks for having me on your belt this afternoon.
Okay, talking about cholera, what's the state of the response in Nigeria right now?
It's really important we keep creating awareness because, to be honest with you, sanitation is key to taking it out. Right now, we have over 3,000 deaths in Nigeria, which is as a result of this disease, and we need to take it seriously. That's why I'm excited that the Nigeria Center for Disease Control has put up a report about 12 hours ago, and we're excited that they are helping to create awareness so people can sanitize, they can be careful. You don't just eat anywhere you go, because some of the symptoms of cholera is diarrhea and frequent vomiting. And you see, a person can be well in the morning and crash in the evening. It's so fast. It kicks in very fast. And when cholera is not treated, it can lead to kidney failure. It's that bad, acute kidney problems.
Right.
That's because you lose lots of
causes.
fluids.
Let's talk about the causes so you don't go into
Very fast, yes.
Very fast. Let's talk about the causes.
The causes of cholera is contaminated food and water. You know, when the stool, basically, of a person is where the effect is where the disease is. So when the bacteria is transmitted into our food or taken by flies or insects into exposed food or water, then you can easily get the disease. And when the disease gets into the body of a person, if not treated, it could be alarming. And that's why we recommend rehydration, oral rehydration, or when they bring the person to the hospital, we take the person through IVF, intravenous.
You know, what bothers me is when something like this happens, because July is a long time till now, and we're still battling. In fact, it's like it's spreading. And I'm very sure that it's not a communicable disease, right?
No, it's not.
It's not.
It's not.
So it can be easily prevented.
Yes.
So I would like to talk about what are the risk factors that could expose you to getting this disease?
Some of the risk factors that could expose you are eating outside. You just branch any place and just eat. You know, those foods that are sold in places where the hygiene level is questionable would definitely bring you a risk. And I also need to state here that when you're infected, there are things you should avoid. Fruit juice is good, but avoid it when you're infected. Anything that would make your body produce more water you need to avoid them because frequent stooling is one of the symptoms. Another thing you need to be careful of is dirty environment. You need to wash your hands properly, frequently. If you're dealing with a newborn baby after changing their diapers, you need to wash your hands properly because it can be gotten through contaminated food or water. And then another basic thing we need to be conscious of, well, the outbreak is not much in Lagos. Right now, we're not experiencing an alarming figure. But we really need to be careful because Lagos is one of the major states where people go out to fetch water. Am I talking? Some other states, they have their water at home or they have wells. But in Lagos, you have more people going to fetch water. And may God help us that the sewage is not linked to the water because that's how the outbreak starts. If there is a leakage between your sewage and the water, cholera can break out in that entire environment.
What would you say about you walk into some compounds, you find that you have a lot of sewage systems together, and you find them in Lagos. It's very common.
Very, very common.
Because
I'm
really worried about the fact that since July till now, instead of it to come down, is increasing. That means there's a huge gap somewhere.
The reason it's increasing is because currently we lack the vaccine.
Okay.
And that's why we're creating awareness and we're saying to able-bodied persons who are fighting some other causes to help us come into this sector and bring in the vaccine so we can help take care of more people. And we also need to keep creating awareness. If you're stooling frequently, you're vomiting, you're having flu, just go to the nearest hospital around where you are. You don't have to faint before you go to the hospital. You know the African syndrome. Until we break down, we don't see a doctor. It's wrong. In the UK, it's necessary to undergo checkup from time to time. You don't have to, the car does not have to break down before you service it. You get what I'm saying? Now let me tell you another thing I saw when I traveled. I traveled for the first time and I discovered you are not permitted to sink a borehole until you are permitted.
Great.
In my house here, I just paid somebody money, they did it for me without the approval of the governor. Like anybody can sink a borehole, that's what I'm saying. But outside, the government will need to come check. They'll check the environment before they
outside, you mean other
outside
states?
The country.
Okay, outside the country, not
Outside the country.
in Nigeria.
No,
okay.
in Nigeria, anybody can dig boreholes anywhere.
Okay.
And then another thing I found out outside the country, in most developed countries, is that you're not permitted to have a sewage.
Wow.
Yes, you're not. Even
when it's your own house.
I'm telling you, you're not. Because the government has prepared a sewage system that goes through. You see the way water is
like
giving,
a central sewage system.
Exactly, that passes through. So it collects it from your house. So the way you pay for light is the way you pay for sewage, and then it's the way you pay for water. They have different channels.
So you know you're in a very busy city, Lagos.
Yes.
You know how it is, sit in traffic for
That's
hours,
why we
also
need
and
to be
bustle
very,
of
very
Lagos.
careful.
What is the first aid treatment you give to someone that you feel has come down with the symptoms of cholera?
Salt and water solution, rehydration. And you see, some pharmacies sell the solution.
Okay.
Yes, it's an oral solution. Just like I was saying the other time with you, the vaccine is also an oral solution. It's not something you have to be injected.
Okay.
It's something you're giving.
Like polio.
Yes.
Okay.
And it's really good that people know what the symptoms are, so that when you start having stool frequently and you're losing fluid, you're feeling like you're losing energy, the electrolytes in your body is depleted, that's the point where you need to go to a healthcare specialist. You need to talk to a doctor. I have a problem with people who come up with a whole lot of fictitious idea. Village people are following him. Oh, it's another attack. And instead of them to take precautions and maybe take home remedies, they start praying. I love God. I believe in God. I worship God a lot. But we must not overemphasize the place of health in our religious activities. Because most of our religious personnel, our fathers in the Lord, they have personal doctors.
So cholera is coming out at a time when we're still battling with COVID-19 pandemic. And in fact, where we are right now is creating awareness for people to go out there and take their vaccine. And you come up with another vaccine. They're talking about vaccine for cholera. What would you say is the relationship between these two disease, because we know that, of course, for cholera, it could just take hours and something bad could happen to that person. I wouldn't want to say vet, but in this kind of situation, how do you separate the two, COVID-19 and cholera?
Well, the two are very different. The discrepancies are wild.
Okay.
But the major determining factor is your immune system. You need to build a healthy immune system to be able to withstand. I tell people that you have been vaccinated from COVID does not mean you cannot be infected. It just simply means that your body will develop enough resistance to fight against it. But there are people whose immune system are strong enough, even if they've not been vaccinated, they won't feel it. There are people who had COVID, but it didn't look as if they had it, because they had a very strong immune system, and they don't have underlying medical conditions. Because if you have underlying medical conditions, that's an avenue for you to break down easily, because there's a defect already in the body. Now with cholera, it has to do with hygiene. You see, one has to do with, and you see, we must eat. Definitely. We must drink. You eat every day, you drink every day. But what you eat,
traffic, you have to eat.
I'm telling you. But what you eat is what matters. And you see, I have a problem with cholera because we have a lot of quack bottled waters these days. You find companies, the same water they put in the sachet is the same they put in the bottled water. And I don't have a problem if you put the same, if it's clean. I have a problem if your system is not well streamlined or well refined, and then you're putting a contaminated water and selling it at an exorbitant price. There are places where bottled water is sold for 3,500. There are other places where it's sold for 100 naira, depending on where you're drinking it.
Oh, yes. Okay, we'll go on a short break. When we return, Dr. Precious is still here with us. We'll be talking about the preventive measures of cholera. We'll be right back. Stay with us. My name is Nkem Okibe, and you're welcome to this week's edition of Health Watch.
Those drugs are prescription only, and they are only to be dispensed by a pharmacist, because we know how they work and we can save you from using it inappropriately.
But at least if you have a cervix, you have a huge chance of never having cervical cancer.
Lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it has been taken.
Glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible.
Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist.
Find out on this week's episode of Health Watch. You're welcome back. The program is still Health Watch, reaching you on the station for excellence, NTA Lagos Channel 10. And with me is still Dr. Precious Uwagbai. Before we went on the break, you talked about the fact that in other climes, you find that you don't just open the ground.
Yes.
Like you don't just dig a borehole.
True.
And that is a major, like, what would I call it now? It's a major solution when it comes to this cholera issue.
True.
But I would like to also know, what is the government at this time doing in terms of the provision of vaccine, and what are they doing at this time? Because you are a stakeholder in the sector.
Well, from the reports we read, Nigerian Center for Disease Control, you can tell that the government is creating awareness, sensitizing people, telling them to follow the preventive measures. And there are a whole lot of things they should do, like washing their hands, wash fruits properly before you eat them, avoid eating in public places, keep your environment clean, drink safe and clean water, and basically eat hygienic food. Eat in places where you know that this place is sanitized enough to guarantee your safety, because whatever goes into the pot of your belly determines what comes out of your life, or what we see around your life, and this is so important. And the government basically is doing all it can to create awareness, to let people know that this is out there. You need to be sensitive, you need to check your environment, you need to be clean. And you see, another thing, the distance between where your drinking water is and where the toilet is very important. Another thing so many people don't know, which I need to create awareness of, is a lot of people have their toothbrush in the bathroom. And the bathroom is just next to the toilet, especially those Lagos landlord in quotes kind of houses. And when you flush, see, some people don't know why the seat cover is there. The cover is not there for you to cover it when you like. It's for you to cover it after use, before you flush. You don't flush
if it's not covered.
When you flush and it's not covered, there are pigments of the feces that can fly out. And if it drops on the brush, now take for instance someone who is infected, a visitor or something has come to your house. Now there's no insect carrying it. He has used your toilet, your brush is exposed, and then there are pigments here and there in vaporous dimensions in your toothbrush, and then you use it the next morning, you're down.
Wow, wonderful illustration.
So we really need to be very careful. If you have your toothbrush in the bathroom and your bathroom and toilet are in the same place, just make sure it's covered. And when you want to flush, cover the toilet and then flush. When you're done, you can now open it.
So we're having two in one. So we're talking about cholera, but it's also telling us how to use our toilets at home. Okay, let's talk about schools. What should be their role? Because I'm really concerned about children. You find a lot of children, especially toddlers, having issues with stooling, vomiting. What is the first aid they should give to children within their environment?
Oral rehydration salt. That's the first. And one thing I need to also let you know is the vaccination can stay for as long as 5 years.
Wow, great.
So I think when we finally get the vaccines in the country, one of the major places the government should ensure that the health workers or the community specialists visit are the primary schools, the nursery schools. Great. Let's get our children vaccinated, because you see, at that level, their immune system is a bit not strong, and it would be very good we protect them. You know, I had a problem when the vaccine got to some countries and they said they want to start vaccinating their young ones. No. When it comes to COVID, now another relationship between COVID and cholera. When it comes to vaccination of COVID, you start with the elderly people because they are the ones more prone. Then when it comes to cholera, you start with the younger ones because they are more prone. Yeah, so basically.
Well, so in 60 seconds, what's your message to Nigerians?
Oh, in 60 seconds, I'll say to Nigerians, let's be clean. Let's stay clean, sanitize our environment. It's not enough to wait for Thursdays before we have environmental sanitation. You can consciously sanitize your environment. Say no to drinking contaminated water. Don't leave your food unattended to before eating it. I have a problem with people who say they want to expose the food for it to get cold a bit before they eat it. You're actually allowing bacteria and insects to feast on the food, and then you eat the leftover. And you know what leftover can do? Cholera is around the way. So say no to contaminated food and water.
Thank you so much, Dr. Precious Uwagbai.
Thank you very much for having me.
In fact, I don't know how to appreciate it, because you give us a lot of things today. First, from cholera to how to operate at home in terms of your toilet, your bathroom. That's a lot of information, because we know that in Lagos, you find people's toilets and bathrooms together. And a lot of us, our brush, you know now, it's just exposed somewhere. Thank you so much for coming on the program.
Thank you for having me.
All right, moving on. Our feature is on effects of self-medication. Enjoy it. We'll be right back.
There are several unhealthy habits that affect individuals and the society at large, one of which is self-medication.
What exactly is self-medication? Is when an individual uses medicines to treat self-recognized illness or symptoms without any medical supervision for the indication, dosage, or duration of treatment. So there's absence of medical supervision. Secondly, when you use a drug given to you by a professional, continuous use of a particular drug for a chronic disease, without going back for review or check, over the years, you keep using the same medication. That's also a form of self-medication.
According to medical practitioners, many things could be responsible for such habits.
One, where there is low income power, you don't have enough money. Number two, when they don't have access to a standard medical infrastructure. Number three, when they don't have enough time, have professionals who are very busy, their organizations are very demanding, so they don't have time to take care of their health. We also have the case of mild disease, when you feel, oh, I'm not really sick, I don't have a problem, I can take care of myself. So this results to self-medication.
Self-medication may be risky and may lead to some serious issues. It does more harm than good to people.
Number one, we have the issue of drug dependency. We have adverse effects, resulting from drugs that you have not taken properly. We have mixed diagnosis when people don't, know exactly what the problem is and they just take the wrong medication. We have the issue of, developing resistance due to abuse of antibiotics. Do you understand? That is very major problem. You have economic loss. You're trying to save money and then you lose money. And then you have the issue of disease progression, in the sense that if you had gone to the doctor at the beginning, it would have been easier for you to handle the treatment. So these are factors that affect, us when we go into self-medication. My advice to the community, my advice to individuals is check with your medical profession, walk into a standard licensed pharmacy outlet for your medication to protect your health. Remember that your health is your wealth.
It is therefore advised to seek medical advice from medical practitioners to avoid any health complications, as health, they say, is wealth.
And that's the much we can take on this week's edition of Health Watch. A lot of things have been said today, from how to prevent yourself from coming down with cholera, and also how to manage yourself at home in terms of if you have a house where the toilet is inside the bedroom or is together, please protect your toothbrush. And I'm sure you learned from Dr. Precious today that for you to flush the toilet, you need to close the cover. That's the lid. It's not for decoration. Cover it then before you flush, all right? And if you have any question or inquiry, please send to okibeinkem@gmail.com or healthwatchntlagos@gmail.com, or send a text only to 07060865487. Remember that health-conscious people live longer, and COVID-19 is real. Go out there, get vaccinated, protect yourself, your loved ones, and everyone around you. My name is Nkem Okibe. See you next week, same time, same station.